I'm Dr. Joseph Shvidler, and I'm a double board certified facial plastic surgeon currently practicing at the Seattle Facial Plastic Surgery Center in Seattle, Washington. A bulbous tip and a boxy tip, and there's a difference between the two. A bulbous tip is broad and round tip that is full and not proportional to the other portions of the nose or face. A boxy tip is also a wide, broad tip, but it has more of a boxy square shape to it. Both of these could be addressed via open or closed approach. The idea behind fixing that boxy or bulbous tip is to modify the cartilages of the nose. So we essentially expose the cartilages via closed or open approach, and then we reshape the cartilages. Sometimes we make little strategic incisions in the cartilage. Sometimes we shape them with sutures, and sometimes we set the cartilages back. So we want to recreate a more triangular or a more natural appearance that is proportional to the rest of the nose and face rather than the full boxy or bulbous appearance. So actually patients see the change even with the cast on, because the cast sits more on the bridge of the nose and there's tape. There may be a little bit of tape around the tip of the nose, but patients see the difference right away. They see that from the bottom of their nose, the shape of their tip is more triangular, it's more proportional, it's not as broad as it was. Sometimes when the patient had a primary rhinoplasty and the lower cartilages were trimmed, in rare instances the cartilages can splay open and they can actually become more bulbous. Or we call it a parenthesis deformity, where the nostrils get pinched and the tip becomes more bulbous appearing, even though in and of itself it's not so much bulbous. So we have to go in and reshape the cartilages and make the cartilages look more angular, proportional, rather than full, round, and bulbous.